Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we've got a great healing exercise for those of you with spondylolisthesis in the lower back that combines several things all in one, known as the Spondylo Lunge. Hope you enjoy. So what I love about teaching my patients with spondylolisthesis of the lower back about lunging is that it's an exercise that addresses many of the common mechanical problems and postural issues that patients have that are aggravating their low back pain. Specifically, many people with spondylolisthesis are aggravated when the tailbone is higher than the pubic bone. This anterior pelvic tilt posture is common with a lot of people. It creates an increased arch or hyperlordosis in the lower back, aggravating that spondylolisthesis where the bone has slipped forward and the posterior aspect of the spine, the facet joints, the disc, is getting compressed. Other soft tissues are being overstretched. It also addresses a common problem with a lot of people with spondylo, which is an external rotated leg. Because we sit with legs crossed, we sleep, we walk, we stand with legs pointed out, many of us have a tendency to turn one leg out more than another. As a result, the external rotators, primarily the piriformis that runs deep from the hip to the spine, become shortened, and this creates a chronic problem where as we move, that leg turns out and it has a mechanical effect of pushing the pelvis upwards or hip hiking associated with a side-leaning torso. So many times when we're looking at the way people walk, the way they climb stairs, the way they bend, the way they lift, they have a tendency to hip hike and torso side lean on the same side that they externally rotate their leg. Another common problem with spondylolisthesis is the erector spinae muscles on the back become overactive, shorten, and again lead to that increased arch in the lower back, which aggravates our lower back pain with spondylo. And that's associated with weak hip muscles, especially the buttocks, which is the glute max, our main extensor muscle. Hip muscles also become weak when we hip hike. So this lunge is going to correct all of these things, or is going to be one healing exercise in our program that helps to correct all of these things. Now you need to know what your unique posture and mechanical issues are. You may have one or two of the things that we mentioned. You may have a lot more. If you haven't yet done so, go to either the Pain Free and Fit or Posturesize website. We have a free body analysis. You can check out your posture and mechanical issues there. Almost everyone with some type of lower back pain, whether it be spondylolisthesis or otherwise, has some mechanical issues, and unless they go identified, you're going to be doing these exercises and you're not going to get the most out of them. In fact, many times you'll only be strengthening the mechanical dysfunction in your body. That's only going to lead to more pain. You want to make sure you're strengthening proper function, which is based on correcting the issues that you have, which ultimately is based on an analysis of your body. So let's get going with this lunge, or stationary lunge. We're going to position ourselves so that our feet are facing straight forward and are directly underneath the center of our thigh. If we go from our knee to our groin, that midpoint, and from inside and outside to the thigh, that midpoint should be directly above our feet. That would be too much of a narrow stance for me, and that would be too wide of a stance. So we want the center of that thigh right above the foot and ankle. From that position, we're going to tuck our tailbone under to a comfortable degree while we hold all our mechanical corrections, all our reverse posture isometrics, RPI corrections. If you have a tendency to turn your pelvis to one side, you're going to keep that straight. If you have a tendency to lean one way, you're going to open that side up or correct it. If you have a weak multifidus muscle, you're going to engage it. If you have an abnormal transverse abdominis, you're going to engage that. If you have a shoulder that turns in, leading to lat tightness, pulling in the lower back, you're going to hold your shoulder in the correct position. Again, that's all based on your analysis. When that's set, we're going to put one leg straight back to a comfortable degree as we maintain the tail under. Once I set tail under, if I don't have that set first and bring my leg back, it's going to cause an arching of the back, and my exercise right from the start has been blown. I'm increasing compression in the lower back. So I want to make sure that as I put the leg back with that tail under, the motion comes from the ball and socket in the hip joint. Once I have the leg back, and by the way, I can do this holding on something for a little balance, we're going to maintain tailbone under, lift the back heel, and we're slowly going to descend straight down. Now, that's different than a squatting motion where the hips are coming back. With a stationary lunge, we're going to come straight down as if I'm in an elevator car moving up and down the shaft. I'm going to feel a pull in the back of my leg. Many people with spondylolisthesis have tight hip flexor muscles, especially the rectus femoris. This is a great exercise to help stretch that. I'm also avoiding, as I come down, the tendency to externally rotate that back foot. I'm going to make sure that that foot stays straight. That's helping to correct the soft tissues of my hip that are causing that hip hiking problem. I'm also watching that the front side is not hip hiking or elevating up. I want to make sure I keep my hands on my hips so I can feel a level and square pelvis. And I want to make sure my rib cage isn't leaning in to that front side. That's also very common. So I want to make sure I monitor the bottom of my ribs with my hands also. Hips level, ribs level. I descend only to a point where I feel a mild pull there, hold for a second or two, and then squeeze the buttocks together to come up. Now, many people with spondylolisthesis have weak buttocks. So in a stationary lunge, the key to recruiting the glutes or the buttock muscles is accentuating that tailbone under tension. What happens is, if we don't accentuate tail under tension while we're in the bottom of the lunge before we come up, what's going to happen is the glutes may under-participate and the hamstrings in the back may over-participate. So by squeezing more tail under, not moving it further, but maintaining a comfortable position, and slightly crunching down, that doesn't mean motion, but tension as if we're lowering the bottom of our ribs, we're going to engage abdominals, which is a key weak muscle in a lot of people with spondylolisthesis, and that's going to help us to recruit more buttock muscle by inhibiting the lower back muscles. And again, just 2 seconds up and down. So I'm avoiding the hip hiking, the rib leaning. I'm watching that foot so it doesn't turn out. I can peek down every few reps to check that. My body is straight up and down, holding all my alignment corrections based on my analysis, and I'm doing my repetitions slowly up and down. I'm also avoiding the tendency to rotate the pelvis outwards away from the front leg. That's going to decrease the stretch in my hip flexors, particularly the rectus femoris muscle. So I want to make sure that I keep that pubic bone turned inwards. That's going to accentuate that stretch, not only on the hip flexors, but some of those hip adductor muscles that run from my pubic bone down to my leg. So that's the alignment. I want to perform that as a strengthening exercise every other day. I can use that anywhere from repetitions, 5 repetitions up to 100 eventually. It's going to help to stretch tight hip flexors. It's going to help to realign soft tissue structures, particularly the hip external rotation. It's going to help train the hip muscles and opposite abdominal and back muscles to avoid hip hiking and side rotation leaning. It's going to train the abdominals isometrically as you're moving to maintain your spine in a more neutral or safe position and help relieve a lot of pain associated with spondylolisthesis. If you like this video and would like to help me share it with others, give me a thumbs up below. If you enjoy this kind of instruction, would like to learn more, subscribe to our channel. We got a lot of great videos out there explaining other healing exercises for spondylo and other soft tissue pain problems. If you want, you can go to our website, painfreeandfit.com, and learn a lot about the intrinsics of building an entire healing exercise program for your spondylolisthesis. We've got a great program out there called the Fast Track Healing Exercise Program. It's available on the Pain Free and Fit website. It's my favorite. A lot of our subscribers are enjoying it right now as we speak. It goes through analysis of your problem, corrective stretches, corrective exercises, corrective strengthening. We go through pain relief exercises when you're having a bad spell, as well as nutrition for pain and inflammation. A lot of good material in there, all condensed in one source. I hope this exercise helps the stationary lunge with your lower back spondylolisthesis.